Hello, Fairfax County Public Schools. I'm Dr. Brabrand, Superintendent of Fairfax County, and welcome to our regular town hall meeting that we've been holding now several weeks since we started this pandemic. And we're here tonight to talk about return to school. I'm so glad you're here to be here this evening. Remember that we've been talking about return to school through the summer as we began our strong virtual start to the school year. Now we're here in October to talk about returning to school in person. So we're glad to have you here this evening. First, I'd like to introduce a few special guests that you'll be getting to see. Our Assistant Superintendent for Instructional Services, Dr. Sloan Presidio. Great to see you, Dr. Presidio. And we also have our Director for Special Services, Leah Skrupski, who will be able to talk about a lot of the health strategies that we're putting in place to make sure that a return in person is a safe return for our students and staff. Again, thank you for coming tonight. We're going to go over a variety of topics around return to school in person, and we're going to take your calls and emails. So thanks a lot for joining us for this hour. We hope it's informative, and we'll be continuing, of course, throughout the school year to bring you regular town halls with the latest information on Fairfax County Public Schools. So I'd like to begin first as we start to really talk to you, Leah, about our return to school in person. The first question everybody is really asking as we look at this is it safe? Let's talk a little bit about what we've been doing to make sure for return to school that we have a safe environment for our students and staff. And it really starts with looking at our CDC, Center for Disease Control mitigation strategies. Can you talk a little bit about what we are doing to employ those strategies here in Fairfax County Public Schools?
Absolutely. Thank you, Dr. Brabrand. Yes, in CDC has outlined for school systems dynamic school decision-making indicators that schools need to use when they're making decisions about dialing up or dialing down instruction, and FCPS will be doing that as well. The CDC indicates 5 mitigation strategies, and these are critical to implementation for us to control disease transmission within our schools. These include the consistent and correct use of face masks, and FCPS has established Regulation 2109 to require the use of face coverings for students, staff, and visitors to our facilities, and we will be implementing these when students return to school. Cleaning and disinfecting, we've been working very hard with our facilities to be able to have all the cleaning protocols in place to address this within our schools, and as well if we have any confirmed cases of COVID we would need to address. Contact tracing and collaboration with the local health department. We've been working very closely with our health department to develop protocols to initiate contact tracing. In each case, what communication will be required both to the classroom and the cohort, as well as our communities. Social distancing to the extent possible. We'll be doing that within our classrooms and also as students transition throughout our buildings and during transportation. And hand hygiene and respiratory etiquette. And you may have had the opportunity already to see some of the strategies and information we've developed and resources for you to share with your children about hand hygiene before returning to school. And our teachers and staff will be reinforcing this with students when they return.
Thank you, Leah. I really have 2 questions on this. It sounds like we've done a lot to prepare to have these mitigation strategies in place. Tell us a little bit more about the mask policy. A lot of our parents are asking, and our staff members as they look at returning to school, what do we do for a child that refuses to wear a mask? How are we handling situations like that? Or a child that may, for a developmental or medical reason, have a need not to wear the mask during the day? What are we doing to help protect our staff and other students for situations like that?
Sure, and that's a great question. Our regulation actually has provisions that would allow for students that may have medical conditions where that would prevent them from wearing face coverings, and that would require a written statement from your physician that would be presented to the school. And in cases where students would not wear their face covering or have behavioral reasons that they need to work through, our teachers are going to be working on implementing strategies to improve a student's ability and feasibility of wearing a face covering. And obviously, health protections are our top priority for our students and our staff in the classroom, for all students. So schools would be working closely with families through that process should there be a reason for us to continue to do that over time to improve the ability to wear a face covering for a student that may have difficulty with that.
Thank you, Lee. And I also understand that a student who continues to refuse to wear a mask for any other reason, just for simple refusal, obviously will bring the family in and counsel them. But ultimately, if there's a continued refusal, we don't want to make this a disciplinary issue for kids. We want it to be about health and safety, but we would recommend and require that student to return to virtual learning if they're simply going to come into the in-person environment and not wear a mask on a daily basis. One of the other questions that's come up around those mitigation strategies is temperature checks. How are we using or not using temperature checks as a strategy? Lots of folks see that going on out and about as you go to hospitals or other places of business. How will Fairfax County be using temperature checks and in what venues?
Sure, that's a great question as well. We actually are going to be asking our families to do health screenings and temperature checks at home and to keep sick children at home. But we will be implementing temperature checks with cohort level 2 for groups 1 through 6. And that will be at bus stops with our bus attendants and also upon arrival to school from students. So what will happen for any student at a bus stop that demonstrates a temperature of 100.4 or higher, they would not be able to board the bus that day. And for any student at school that arrives with a temperature of 100.4 or higher, they would be escorted to the isolation room and the school health aide would do some further assessment.
Thank you, Leah. One of the other big issues about is it safe to return? It sounds like we've really answered that we put the strategies in place. But the next big discussion that really has come up with the public is there transparency in sharing the data? We need to know what does COVID look like in our community and what does COVID look like in our schools. What are we doing now around confirming COVID-19 case reporting and sharing that information with our community, our staff, and our students and parents?
We're working on, as we said, our protocols with the health department, and we have developed protocols where we will be communicating with our community anytime there's a confirmed case of COVID in your school. We also have been working on sharing that information with our community and have developed a COVID-19 case reporting dashboard that's currently available on our website.
Wow, so I think this is an example we're going to put up now on the slide. Can you walk us through this dashboard, please?
Absolutely. And what you see here are confirmed cases of COVID that have been self-reported to our staff. And we've worked very closely with the health department to address each of these cases and followed public health recommendations after. Each week we're reporting cases for our employees, for visitors to FCPS facilities, as well as students. And you will see that within that we also have supporting return to schools or SRS programs, employees and students included in that. And we've actually done a great job in working with them and communicating with them with some of those confirmed cases that have happened on a few cases already.
So obviously these numbers overall seem very low given the huge size. Of course, we're still mostly in virtual learning, but we really will need to monitor these numbers carefully as we do return to in-person and continue to work closely with the health department to help us as we make decisions about continuing to dial in and doing additional return to school. But it is so important to have transparency around that kind of thing. And I know we've gotten help from the state as well with the VDH dashboard to really share what the general community COVID conditions are. Can you talk a little bit about that dashboard that the state has provided us that we didn't have this summer that we do have now?
Sure. Actually, the Virginia Department of Health has released VDH pandemic metrics, and they also have CDC indicator or school metrics available for you on their webpage. They're also going to be soon releasing a COVID-19 outbreak dashboard that will be available. And this dashboard will house information about COVID-19 outbreaks, which they define as 2 cases or more in one facility, and that will include K-12 and educational systems, colleges and universities, and long-term care facilities. And that information will be available to you by school.
Fantastic. Well, let's take a phone call. Caller, welcome to the Return to School Town Hall.
Hi, good evening. I am very concerned by the new concurrent model that was proposed at last week's school board meeting. I was especially surprised since we were told at the town hall this summer that we would not be using this type of teaching model. So my question is, how were teachers and our local teacher associations involved in the development and approval of this concurrent teaching model? Did these groups give approval? And does FCPS plan to give more staff the ability to have input in this model?
Thank you, caller, for that question. You know, let's segue into having Dr. Sloan Presidio join us. And before you answer that call, Dr. Presidio, let's go to a slide that I think can share the concurrent model. Concurrent model is something we really didn't even have in our vocabulary even a couple of months ago. What is the concurrent model? What is concurrent instruction? And what is our approach as we look at return to school around using that model?
Yeah, thank you very much, Dr. Brabrand, and thank you, caller, for that call. I think at its simplest terms, the concurrent instruction model just means that a teacher is assigned to work with students who might be in different physical locations. So in this particular instance, during the pandemic, a teacher would be assigned to work with students who might be coming into the classroom to receive in-person instruction and might also have some responsibilities for teaching students who might be choosing the at-home online option as well. So really at its most basic level, it's an opportunity for us to make sure that we're providing instruction to students who might be in different locations at different times.
You know, actually, can you go over the concurrent model? I don't know whether we got to. Let's go back one slide. Can you just show on the graphic that concurrent model as viewers are looking at this, what you just shared a little bit more by looking, having them look at the graphic, and then we'll walk through some of the benefits.
Sure, absolutely. So the concurrent model, of course, as Dr. Brabrand mentioned, is a new term. It's certainly new to us in Fairfax, and it's relatively new, I think, to K-12 public education. It's used, and it has been used for some time in higher education. So again, you might think of a college course where there might be students who are learning remotely and students who are learning in the classroom. And we have used concurrent actually in a few classes in Fairfax County as well, when we've been teaching students who are in different physical locations in different schools. But it is a new term for us, and certainly there's a lot of information that we could try to unpack with respect to the concurrent model.
What are some of the benefits to the concurrent model? Why don't we share some of those?
Sure. So if I could just share a few of the benefits. Again, I think the largest benefit to this particular model at this time is the opportunity for students to receive 4 days of teacher-supported instruction per week. When we come back into in-person instruction in Fairfax, we know that we're coming back with social distancing guidelines in effect, which will limit the amount of students who can be in a classroom at any one time. With the concurrent model, we could bring students back into the classroom 2 days a week, and on the days when those students are at home, they could continue to receive teacher support. So 4 days a week is really the largest, I think, one of the largest benefits to the concurrent model. There certainly are others, which I'd be happy to speak to if there's more questions that callers might have. But 4 days a week is a big benefit. And I think it's also important to remember with our models, we're looking to promote equity wherever we can this year. In particular, we're really focused on keeping equity at the center of our work. And we did provide parents the opportunity to choose either full-time online or in person for their students this year. And that full-time online option will continue to provide 4 days of teacher-supported instruction. So concurrent would give that same opportunity for students who are selecting in-person instruction.
You know, Dr. Presidio, one of the other questions is how do we involve teachers from the caller? And I know we're doing a lot right now to involve teachers as we do multiple pilots of the concurrent model before we return to school. And we did have some conversations as we were looking at many models over the summer to include the concurrent model with our teacher association leaders and other teacher groups, sharing with them the pros and cons of the model. But we're really doing a lot now to pilot that and give teachers some feedback. You want to share anything about our pilots and our work there?
And I think, you know, with anything that's new, we need to include stakeholders as frequently as we can and as authentically as we can. And this is a new model for us where, in the process right now, as Dr. Brabrand said, of putting some pilots in place. We have a pilot that started this week at the elementary and the secondary level. We're expanding that pilot out next week. We'll have about 13 schools that will be piloting the concurrent model. That will be at every grade level, elementary, middle, and high across our system. And that's going to give us a really good opportunity to learn from the teachers who are instructing students in a concurrent model. We'll learn a lot about best practices, what works, what doesn't work, the kinds of supports that teachers and administrators need to make a concurrent model work. And if all goes well, we'll be able to take those lessons learned and turn them into resources and professional development to expand the model over time. But I think one of the main things we want folks to know about the concurrent model is it does not mean 100% synchronous activity happening in the virtual space and in the classroom space at the same time. There's a lot of flexibility about how the teachers would work with students who are at home and accessing that teacher support virtually. There's a lot of flexibility in how do we do that, and we think the pilot and that continued collaboration with teachers will help us learn a lot about those best practices.
And we had a meeting with the school board last week, and we're going to present an interim report on the pilots and how that's going to inform our continued work as we move forward for return to school. So thank you, Dr. Presidio, for sharing all of that information. I do want to share real quickly the elements guiding our phase-in decision-making and just briefly show you where we are. Again, we're looking at a variety of metrics: health metrics, FCPS operational metrics around staffing, FCPS operational metrics around mitigation strategies that Leah just talked about a few minutes ago, and FCPS operational metrics around school and staff readiness. For groups 1 through 4, which are some of our neediest learners, we are a go on all of those areas. In fact, we already have some students back in our schools in the first groups, and we have groups 3 and 4 coming up very soon to return to our schools. For level 2, these are groups 5 and 6 that include kindergarten and first and second grades. We'll show that in just another minute in a moment, and some other students are some of our most vulnerable students as well. We are a go in all of the areas, and we are completing our staffing review now, working to make sure that we have everyone in place to be able to support moving forward. And for our level 3, which are our middle and high school kids and our upper elementary kids, they are kids that in our current instructional program move throughout the day. Those are still in level 3, and we have that as a caution. We do have timelines for them to return, but we need to continue to monitor our health conditions and our staffing to support those. So I am thrilled to have one of our newest members of our leadership team who just joined us this year in the middle of the pandemic, believe it or not, Dr. Michelle Boyd. And Dr. Boyd, you're our Assistant Superintendent for Special Services. I want to walk through for a moment the groups that are coming in and talk a little bit about that equity lens that we're putting on wanting to bring back students who are our most vulnerable and most in need of in-person instruction. As good as we've done with providing virtual, we know that for some students that still falls short. So we are looking to bring them back. We're going to follow all the strict safety and health protocols to minimize risk. And you can learn more about that, as you can see on the slide here, at going to fcps.edu and search Student Health and Safety Guidance Document. So here are the following groups of kids that will be coming back for in-person instruction, and these are the start dates as of now approved by the school board last week. November 16th is the tentative date for early Head Start, pre-K, kindergarten, intensive support needs, and specialized center programs. Dr. Boyd, can you talk a little bit, many people know about kindergarten, of course, and are excited, but talk a little bit about early Head Start, our intensive support needs, and some of our specialized center programs.
Sure. Thank you, Dr. Brabrand. As you shared, our groups coming back in groups 1 through 4, we started with our preschool students that are in special education settings. These are students where we want to intervene early and often as they begin that initial eligibility process. So it's really, really critical and imperative that we're able to provide those hands-on supports for those youngsters at those early ages. The bulk of our students with disabilities coming back in our first groups in 2 through 4 are students who are instructed in the adaptive curriculum. And these are students that, because of their significant disabilities, significant cognitive disabilities to be more specific, they're instructed with a curriculum that's been reduced in complexity and depth and really require the multifaceted support of a number of providers. So students that may be coming back in those groups may have individual nurses, they may receive high levels of related service supports, and have services provided by our special education teachers who have that specialized knowledge. So those are also students that, again, require the intensity of support even when we're in the brick and mortar setting. And so it's really, really imperative that they have access to those direct specialized supports during COVID so that we don't have significant regression.
So those are those groups 1 through 4, and they're actually already approved for coming back in. And now in group 5 that we're looking at in just a few weeks are kids with intensive support needs. Talk just a little bit about who those kids are and how we'll be supporting them as they return next month.
Certainly. So we started with the other group, but after reflecting and getting some additional information, we still realized that there were another group of students with disabilities who are being educated with our general curriculum, but still require high levels of support and actually have their instruction modified. So some of their expectations for what they will know and be able to do have been adjusted based on their baseline knowledge and trying to build that support. So that group, we feel like it's imperative for them to come in as they already spend a large majority of their day with those special education teachers, getting that very targeted support, again, so that they don't regress and we can really work very intensely with them. Both of the groups that we talked about, again, because of the high levels of support and because of how they're instructed, they can be brought back during our cohort level of operation because we can keep those groups pure and they're not required to mix groups and to intermingle. So we're able to implement those mitigation measures that Ms. Gerpsky talked about previously while also making sure we address those very targeted and high need educational needs for those students.
Great. And let's just look for a moment at the other groups. That's group 5 again with pre-K and kindergarten. Group 6 would be at the end of November, grades 1st through 2nd. Again, these groups have been approved by the board, and we are moving forward to implement those timelines. And they include grades 1 and 2 and specialized career centers for special education at our Davis and Pulley centers. And then finally, just to share the remaining 2 groups with folks, Group 7 has a tentative date of January 4th. This is grades 3 through 6. It also includes our secondary public day programs in special education like Burke Middle School, Cedar Lane and Quandra Road, and the Davis and Pulley Center. And then the final group, Group 8, is a February 1st tentative date, and that includes grades 7 through 12, really our middle and high school kids who will mix a lot as part of the instructional model that we have had here in Fairfax County, and most middle and high schools have, our rich electives, our rich core courses, and we would have those folks coming back really almost as we begin the second semester of the school year. If we can go to the next slide, I'd like to just see, is there a next slide or is that the last slide that we have? That's the last slide that we have. All right, why don't we take a phone call? Caller, welcome to the Return to School Town Hall.
Hello, thanks for taking my call. Given the flexibility provided by the concurrent learning model, along with students who prefer to remain virtual or who have withdrawn, what is preventing kindergartners from returning to full-time, face-to-face instruction 5 days per week?
Sure, I'll be glad to start on that, and Dr. Presidio, if you'd like to add. One of the first fundamental things that I shared actually several months ago to a national audience is the simple issue of 6-foot social distancing. We would need an additional 5 pentagons of space to accommodate our kids 5 days a week. And that is just not possible. We'd love to get all of our kids in every day, but our health conditions and the CDC guidelines simply don't allow it. We are working and looking at the model for our youngest learners, but it is important to understand in the concurrent model, which we are continuing to look at, that our very youngest learners still, we're hearing as we do the virtual start of school year, we are learning that it is still a struggle for some of our very youngest learners to stay continually interactive through the screen with the teacher. And so that remains a struggle as well. Is there a way to come up with other models that can help limit that interactivity. But that issue and the simple function of facility space to accommodate all kids while maintaining 6 feet social distancing is why we're not at 5 days in person. Thank you, caller, for your question tonight. Let's take another phone call. Caller, welcome to the Superintendent's Town Hall on return to school in person.
Hi, is that me?
Yes, welcome, caller.
Hi, thank you. Dr. Braver, I really want to thank you for your time and effort and energy that you and the FCPS leadership have put in toward trying to solve this issue. I don't envy you in the slightest, and I'm sorry that you can't please everybody. I'm calling because I am a current parent, and I'm also a full-time teacher. My question kind of has 2 parts. The first one is that families were given 100% choice about whether or not to send their students into the building. No questions asked. Staff were also asked their preferences, and staff, like me, with medical concerns, applied for ADA provisions and presented that paperwork to the county. Now we're being told that our ADA considerations may or may not be honored, and we may be forced to either take a leave, resign, or retire, or go into our old buildings without updated HVAC and teach so that we can continue to get our paycheck. How is that fair and equal? And what is your plans with regard to substitute teachers when we already had a bad shortage of teachers subs before this even started?
Well, thank you, caller, for that question, and I really do appreciate your feedback. It is a very challenging time. We need to do everything we can to support our students and staff, and it is balancing so many factors. But I do have with us tonight our Assistant Superintendent for Human Resources, our Acting Assistant Superintendent for Human Resources, Sean McDonald, and he can help walk you through what we are working to do to try to meet ADA accommodations for teachers that have them. Mr. McDonald?
Well, good evening, and thank you, caller, for that question. So we are in the process of reviewing the ADA accommodation requests that have been submitted thus far. We did receive over 2,400 requests, which is about an 8,000% increase over where we typically are. And so our team is working as hard and as quickly as they can to ensure that we're following the process as it's outlined in the ADA law, but also taking the care and the concern to walk folks through and help them navigate the process. It is a very time-intensive process, and our goal is to get through all of those requests as soon as we possibly can. We do have situations where schools may not be able to accommodate the request based upon student need. And so our goal is to work with administrators and work with the individual staff member to see if there may be alternative accommodations that might be available to help assist in that situation. When there is not that alternative, then we will be offering folks an opportunity to take a leave of absence for the balance of the school year. It's ultimately not our first choice, but it is an option or a path that we may have to pursue. What I will share with you is that we are currently exploring some other options, possibly using the concurrent model, where we may be able to help in situations where we can't accommodate, make an accommodation possible. And so as we navigate those next steps, we'll be able to share some additional information. I anticipate being able to send out a communication later this week, which will provide some additional information related to that concern and address those concerns. Related to the substitute teacher question, we have had a challenge with filling substitute needs in the past, and we do anticipate that we will continue to face similar challenges. Just as other folks have expressed, a number of our substitutes have asked to either work in the virtual environment or sit out this year based upon their own health needs or situations. We have been working with our substitute pool to get folks motivated and engaged in the process. And we've identified individuals that have expressly indicated the fact that they'd like to come in and work with students face-to-face. In those situations, we're providing additional training and support, ensuring that folks have the PPE that they need to complete the tasks that they're assigned safely in the schools, and we'll continue to work to engage our substitutes and provide our schools with direct contact information for those individuals to really ensure that we're making matches where we need to.
Thanks, Mr. McDonald, for that. I really appreciate that. And thanks for all I know that Human Resources is doing under your leadership to really walk that important balance of trying to ensure student success for all of our kids while acknowledging the caring culture that we all aspire to have here in Fairfax County Public Schools. It is a truly difficult moment. It is, and we're trying to do everything we can to keep our teachers, but also to provide instruction for students. And it is clear that the school board, working together with the administration, even as we agree to begin virtually, we were asked to bring a plan to return kids to school in person. We're beginning that plan, and we want to work very carefully with our teachers to make sure that we can honor the students' needs and, to the greatest extent possible, our staff's needs as well. Thank you for that question, caller. Let's take another phone call. Caller, welcome to Return to School Town Hall.
Hi, my question is in regards to the concurrent learning model. And in the slide that was shown, it said that there will be no, quote, double planning because the students who are at home will be doing the same activities as those who are in person. If this is the case, then what is the academic and learning benefit to returning in person, since we will only be able to do the same activities that we're doing now?
Dr. Presidio, you want to take the question on that concurrent question?
Sure, thank you, and thank you, caller. That's a great question. You know, there's a lot of academic benefits, of course, to being in school, just those connections with your classroom teacher, your peers, the way that you're able to actually work with the teacher and get some individualized support and attention. We're also able to provide individualized supports for some of our special populations, English language learners, special education students, in the in-person setting that sometimes would be more difficult to do in a virtual setting. But there's also, again, just those social emotional benefits. We're hearing from so many of our students that they miss being able to have those opportunities to interact and connect with their peers and to see their teachers. So there's a lot of different benefits, both socially, emotionally, and academically, to being in person. And we want to get our students back in person. We want to get them back as early as possible and as frequently as possible.
You know, caller, that's such an important question, and I want to share something that I think all of us are facing as we look at COVID in our country and our world. COVID is not a week in the spring. It's not the end of fourth quarter from last year. It's not the summer. It's not the fall. COVID is here for the long haul, and we have to figure out how we in Fairfax County Public Schools and in our community are going to live with COVID moving forward. Our kids need to be back in school and be in the routines as much as possible, but we need to be sure that we're doing it in a manner as safe as possible. We cannot go months and years without having our students return to school. Other countries are finding a way, and other school districts across the country, working together collaboratively with teachers and principals and parents and our community and their communities, are coming together and returning to school. We need to monitor the data as we return to school. We need to report the data, as Leah shared earlier tonight, and we will. And we need to do everything we can to bring our kids back into the school building and restore that in-person instruction. That's our commitment. This is a commitment the school board also supports and has supported even from the beginning. And we are committed to doing that in a safe and responsible manner for our students and staff. So I wish COVID was going away tomorrow, next month, and next year. But the reality is we must learn how to live with COVID and return to school. And I believe we can do both. Let's take an email. email, what have big school districts across the country been doing to successfully reopen schools? Dr. Presidio, I know we've been studying a lot. I did see just earlier today of the 50 largest districts, while almost all of them opened virtually, now all but 20, so over 30 of the 50 largest districts are now in the process of returning kids to school. We are one of those largest districts, and we already have kids back in school and are in the process of doing the same. But what are we learning as we look at other districts, Dr. Presidio, about how to do a successful reopening?
Well, of course, one of the challenges is that districts are doing things in different ways based on the local health conditions and the guidance that they're getting from their state health officials, their state departments of education, and local community health officials. So we do see some communities coming back a little bit earlier than others. And those groups that are coming back and those school systems that are coming back earlier, when you think about larger school systems, we see a lot of those larger school systems in Florida. 3 of the 10 largest school systems in the country in Florida are already back. They're back for in-person instruction, in most cases 4 days a week, and providing concurrent instruction for students and families that want to choose to stay virtual. So we are seeing different models, but again, it really kind of depends on those health conditions in that state and in that local community.
You know, there really has been a recently published study, I believe, from Harvard University looking at all the return to school so far in terms of COVID, and the transmission rates are extremely, extremely low, less than 1%. Again, that varies by region and the conditions. We need to be able to share, and we are, what our conditions are across Fairfax County and our Northern Virginia community. And as we committed to this evening and at earlier times with the school board, a commitment to transparency around the COVID cases that we have in our schools, as reflected in our dashboard, and we'll continue to communicate that out. We know that COVID is going to remain a matter of public concern of the utmost importance, and we need to continue to communicate that concern and share the information as we return our kids to school. Let's take another phone call. Caller, welcome to the Return to School Town Hall.
Yes, is that me?
Yes, welcome.
Thank you so much. I know this is a big task, and thank you for doing this town hall. Dr. Bradan, there was a caller before that asked if teachers approved the concurrent plan, and I can say that we did not, and we didn't really know about this. Many of the teachers are very fearful about returning to the classroom. Most of us are working nonstop with this virtual learning. The concurrent learning plan that was shared to the school board last week will actually create 3 times more work for teachers, not half as much as Dr. Presidio stated, so I respectfully disagree with that. I also just learned today that students in school, when they go into school, the in-person students will not have the ability to do anything online because the school's bandwidth will not provide that. So teachers then will be forced back into the classroom, will essentially be teaching 3 different modalities at the same time. How is that really best practice for our students, and how is that really even possible for our teachers?
Well, thank you, caller, for that question. You know, I really do appreciate your perspective and the perspective of every FCPS employee and staff member as we look at this. One of the things, as we shared earlier, we are undergoing 13 pilots as we speak this week to make sure we've answered the questions that folks have. I do want to directly address the issue of technology in the classroom. We do have the bandwidth to make the concurrent model work in all of our schools in Fairfax County Public Schools. How that exact application is of the technology in the classroom is part of what we are doing in the pilot. But we do have the bandwidth to provide for a concurrent model in Fairfax County Public Schools. I have to say, as much as I hear the concerns about the workload for return to school, I continue to receive emails on a regular basis about the current workload, even in virtual instruction. The reality is the work right now, whatever the model, even if we're returning to school 5 days in person, but in a COVID environment, is still going to be hard work. There is no easy model, no easy approach, no easy strategy in this time of the pandemic. We're all trying to do what's best for kids, and we want to return our kids to school in a safe and responsible manner. Principals are working with teachers and working together with you to make this work. And we have to continue to have the spirit of collaboration and cooperation. We will do it. We're going to share the results of the pilots in just a few weeks. And I believe we can find a way to return kids to school and make sure they continue to have strong instructional strategies for them, and that we can support our faculty with the professional development and the needed time, including moving our Mondays to full planning days, as we proposed last week to the school board, as we return groups to schools. So we're going to continue to work with you on these issues, and we understand that any change right now brings its own set of challenges, and we're here to work with you to work through those challenges. Let's take another phone call. Caller, welcome to the Return to School Town Hall.
Hello, and thank you for having me on. My question is in regards with the VDH and CDC school metrics. I've been following those a lot recently, and I've been noticing that most of the metrics for Fairfax County are at the high risk and moderate risk of having an outbreak in an education setting. And going from Monday to Friday last week, almost all the metrics, except for the percent change in new cases per 100,000 people, increased.
Yeah, thank you, caller. I brought Leah back, and I'm going to turn to her in a moment, but I want to emphasize something very important to this entire community that's embedded in your question. What if health conditions worsen than where they are right now? Our overall community transmission rate is low, but what if it worsens? The approach that we have shared with the community and the school board for the initial groups 1 through 4 and groups 5 and 6 that were just approved last week, are based on a cohort model where kids stay in a bubble and they are not moved around during the school day. The state guidance and CDC guidance supports a cohort instructional model even at levels of moderate or even towards substantial community transmission. We, with the right mitigation strategies that Leah outlined earlier, can make cohort learning work in person with the cohort instructional model and the right mitigation strategies. Leah, can you speak a little bit more about that and maybe fill in where I might have missed?
Sure. Thank you, Dr. Braybrand. And that is a really good question. The Virginia Department of Health has provided guidance to us that we are to use the CDC indicators for dynamic school decision making. And you are correct that some of those metrics are higher at this point, but some of those are lower. One being the total number of cases in the last 14 days. Currently and to date, our numbers are 115.6, which is in the higher range. But our percent of positivity, which is another CDC core indicator, is 3.5%. So that indicator is in the lower range. But the third core indicator that we are assessing are those ongoing use of the 5 key mitigation strategies as shared by the CDC. So we are carefully looking at all of those core metrics when we are making decisions about dialing up and dialing down instruction. So our implementation of those mitigation measures and keeping transmission from happening within our schools will be very important, and we'll be looking at that data within our schools as well as the outbreak data that VDH will make available to us soon in their VDH dashboard. So we'll be giving consideration to that, but looking at all those things at this time, FCPS considers ourselves in the moderate transmission risk level, which aligns to operational level 2, cohort learning, and we're implementing phase 2 governor's guidance. But we will be looking at that closely as we consider dialing up instruction in the future.
I think one thing, Leah, to say to this community, again, COVID is long-term with us. There may be moments when COVID goes up and moments when COVID goes down. We need to continue to have the ability to give one another grace, that the situation today may not be the situation tomorrow. And we have built into our plan flexibility to return or dial in for more in-person learning, but also dial out or dial down for less in-person learning and more virtual learning. So we're going to continue to look at conditions on the ground, to monitor those, to share those with the community, and make the appropriate operational decisions based on those metrics. Let's take an email. Will parents receive another chance to make a decision on sending their child back to school, or does the summer decision stand? When will we know if your child has been selected to return? So we will be sharing out with families later this week. It is our plan to do later this week information about confirming your intent from this summer. We do want to do everything we can to honor your summer request, but we will be asking families to reconfirm. If we don't hear back, we will assume your choice stands from the summer. And that information will be going out again late this week or early next week, but we're really striving to get it out very soon, especially for our groups coming up, groups 5 and 6. So that we can make the necessary adjustments to staffing as needed as your children return to school. Let's take another phone call. Caller, welcome to Return to School Town Hall.
Hi, I'm a classroom teacher, secondary level. My daughter is an elementary student. A couple questions back, you were all asked about the value of returning students to the classroom, and the answer was about student-teacher interaction. Right now, my students are able to work in small groups through the breakout room function in Google Meet, and I'm able to do individual conferencing one-on-one with students through separate Meet links. And I've seen my daughter's teacher, who is incredible, do the same kinds of individual interactions. None of those will be possible in a concurrent model. We can't work in small groups because of social distancing rules, and we won't be able to individually conference with students on Google Meet because we will have other students in the room, and students won't be able to connect to us through Meet that way. So Dr. Presidio mentioned the value of student-teacher interaction, and I was wondering if he could share what he sees student-teacher interaction looking like in a class that is socially distant and where students are both in person and in Google Meet and people are wearing masks.
Dr. Presidio, do you want to start, and maybe I'll share a little bit afterwards?
Yeah, absolutely. And thank you, caller. That's a great question. And thank you for sharing the work that you're doing to really create those opportunities to develop and maintain strong relationships with students in a virtual environment. That's incredibly important. And we so appreciate all the things that our teachers are doing to make that happen. That being said, we do continue to hear from families and from students and from teachers as well about missing those interactions, those in-person interactions with students, being able to see each other's faces, being able to spend more time throughout the day, having those interpersonal interactions with students. And at the secondary level in particular, and we see this at the elementary level as well, we're just seeing a lot of missed opportunities for those students to have extracurricular opportunities and connections, clubs, activities, things that just really don't translate into the virtual space are really big pieces that motivate students to come to school, keep them engaged, and those things are really, really difficult, again, to replicate in the virtual space. So those are some of the things that I was talking about in terms of those opportunities.
You know, we shared with the community months ago that our goal for the entire time has been returning to in-person learning. There is no substitute for in-person learning. We have done an amazing job because of our amazing teachers and support staff who've gone above and beyond the call of duty to make virtual learning as robust as it can. But some of our kids are thriving and some of our kids are not. As much as we're hearing wonderful things from some parents, we're hearing stories of kids that are thoroughly tuned out to the computer screen, who are growing more and more depressed that they're not able to connect with their peers in a face-to-face environment. We are, as human beings, part of the trauma we are all experiencing, myself included, who loves to be around people. The trauma of not being around many of our loved ones, our classmates, our friends. We need to reestablish the vital social emotional component of learning in addition to the cognitive academic part. We need to bring both back together if we're going to bring our children back and make them whole. We have to educate the whole child here in Fairfax County Public Schools, and that means academic and social emotional supports must be integrated. They can best be integrated in person. Let's take another phone call. Caller, welcome to the Return to School Town Hall.
Yes, hello.
Hi, welcome.
Hi, thank you for your time. I am a concerned educator who looks forward to being back in person, teaching in a safe setting. However, I'm calling in about your proposed teaching model, not only for teachers, but even more so for our students. Tonight you shared an image of a slide depicting what a concurrent model will look like. I have classes of up to 27 students in them, with many other teachers having even more students in one class. I feel that showing a class image with only 11 students using the concurrent model and saying it is flexible is giving parents such a false sense of what it will really look like for their children who are supposed to be learning at school and online at the same time. My question for you is, how can you be comfortable telling parents using a model that has been shown not to work well across the country with a focus on quantity over quality educational experience, that this is what is best for their children? My hope is that you move forward with the face-to-face hybrid approach that was already agreed upon by staff, parents, and board members. Thank you.
Thank you. Dr. Presidio, would you like to talk a little bit about the caller's question around the concurrent model and the concerns that she has shared?
Yeah, and again, I think these are really legitimate concerns, so we appreciate the folks that are calling in today and listening. I think one of the misconceptions with that graphic that the caller discussed is that it would appear that students are working synchronously from home and in the classroom throughout the entire class period, and that is not the case. We know that that would be very difficult to manage. In some instances, that would make sense, but certainly not in all instances. And I think the thing that we want to really stress to folks is that those students who are at home on those or at-home asynchronous learning days, we need to make sure that they're connected to learning just as much as the students who are in person are connected to learning. And we do think that there are opportunities to use the technology that we have available in our schools and that we've provided to our students to make sure that there's opportunities for the teacher to check in with those students who are at home, give them directions about the asynchronous assignments, provide opportunities for them to work together in collaborative groups online and continue to have a support structure while they're at home, and to continue to be able to have access to the teacher where they need support. But that doesn't mean being synchronous and managing for the entire class period or the entire class day both of those learning environments simultaneously. There's a lot of flexibility in what that model could look like. There's a lot of different learning strategies and pedagogies that we're looking at that we've been researching. And we really believe in the pilot that we're going to be able to have an opportunity to really understand what those strategies would look like in Fairfax and hopefully be able to share those that are successful in ways that could be implemented in other classrooms as well. And again, different people will have kind of a different sense of what this could look like in a particular classroom, but we definitely do not want to give the impression that you would have to be synchronous with students in person and at home 100% of the class or 100% of the school day.
Thanks, Dr. Presidio. Let's take another phone call. Caller, welcome to the Return to School Town Hall.
Hi, thank you. Can you hear me?
Yes, welcome.
Thank you for your time, Superintendent Broadband. I had a couple of questions. First of all, I want to say thank you. I know it must be a hard task to be working in a collaborative way in terms of looking out for the students, the families, and your staff. And I do want to say that I think your teachers doing an exceptional job at virtual distance learning. In particular, I know there are some struggles that we need to get through, but in my experience, my son has been able to get through that at at the will of your teachers, so I appreciate that. And I am in support of keeping all your teachers as well as students and your staff safe. That being said, I was wondering, how would you handle a particular outbreak if it comes in place in terms of your schools? My understanding is that there has already been an outbreak to the point that one of the youth had to be hospitalized. And who will cover the expense for that child's medical expenses if that were to happen? Would you put that on the family, or would you put that on the school in terms of, since you're having to bring the children back to the school? And my secondary question was, is every school within Fairfax County HVAC system being altered in terms of the things being filtered so that there is better efforts to mitigate COVID?
Well, thank you, caller, for that question. First of all, I'd like to share with you, the first thing to know is that we respect parent choice, and you will have the choice, if you wish, to continue to have your child receive instruction virtually this school year. That choice was on the table in July, and it remains on the table now as we look at returning to school in person. Ms. Skrupski, do you want to share anything else around liability or concerns that we have had in Fairfax County this summer and fall around students?
Sure, thanks very much. And as we shared the information that's available on our FCPS dashboard, you'll be able to see the cases that we have encountered in FCPS. And currently, we have not had any cases that have resulted in outbreak or exposure or transmission within our schools. Although we have had a few cases, we worked very closely with the health department to address any of those cases, and we followed any public health recommendations as provided by them. And we've also, in preparation for our opening, developed well-defined classroom metrics and school-based metrics that would look at what we would do to address a case that might happen in a cohort or a classroom that would involve immediate communication with a cohort in the community, as well as what we would do in the case of an outbreak. And should we have an outbreak, we would be working very closely with the health department through their contact tracing and investigation process. And we would also be advised at what community communication would need to go out should we need to transition to distance learning. And through all of this process, the health department, the public health nurses, and the school health aides will be working with families and providing them with information or any resources that they might need to get the medical care and attention that they might need to follow up with.
Thank you, Ms. Skrupski. Let's take another phone call. Caller, welcome to the Return to School Town Hall.
Hello.
Hi, welcome,
Hello.
caller.
Hi, thank you. I have a child in elementary school and a child in high school, and we had some health concerns that haven't been addressed yet. In particular, around when children go to the bathroom, for example, how are we controlling the health guidelines, ensuring they keep their masks on, social distancing, whatnot. And then for high school, the kids change classrooms, and those hallways are crowded. And I wouldn't even see that cutting the number of students in half would work. So how are we keeping our high school students safe, socially distanced while changing classes?
Sure. Let me talk a little bit about that. And I actually, from the other caller too, we are doing the work of reviewing our HVAC systems. We're looking at air quality for those. We're installing higher grade filters. And we're going to continue to look at making sure that our HVAC and ventilation systems are well. We've also worked already to create plans with principals for as much spacing as possible as we make transitions for students in schools. And again, I want to remind you that the plan right now to move toward hybrid learning, operational level 3, is months in the future. And right now we have in our decision-making matrix that as caution for our current health metrics. We'll continue to monitor those metrics, but when they do return, we'll look to limit the mixing of students as much as possible, but we need to recognize that when sometimes during transitions or coming in and out of the school where kids may not be maintaining 6-foot social distancing, that's why masks or face coverings are so important. So it's really a medley of mitigation strategies to ensure that our students are safe when they go to the bathroom, Are we going to be able to clean every time a kid goes to the bathroom? No, we're not, but we're going to regularly clean. We have custodial overtime built in to our budget this year, and we'll be encouraging all of our kids and staff and build in time for regular hand washing before and after using the restroom and before and after eating food. So let's take one more call. No? Do we have time for one more call? Okay, one more call. Caller, welcome to the town hall. You're the final caller, so please, welcome.
I'll try to bring it home. Thank you very much. My question is for the concurrent model. During the current virtual setting, we have a lot of the hours of the day that are asynchronous, screen breaks or time around lunch or breakout or individual times that end up just to be kind of unstructured time. My question is, how is that going to work when the children are in school? If the virtual students are on a break, what will the in-person kids be doing? And similarly, how is it going to work in terms of specials like art and PE and music and lunch for the children that are in school?
Thank you, caller. You know, Dr. Presidio, one of the things I know last week, and maybe we need to even do more of, is we shared a sample schedule, for example, at the elementary level. You want to talk a little bit about maybe the one at elementary and ways that we can help share. And I know we're doing videos around return to school in person that we'll have up on our website soon. So instead of us just talking about it, people can see and feel and touch and experience what it would look like for their kids. But how about the schedule itself? You got the kids at home virtually. How does that match up with what kids might be doing in person for breaks and other things like that?
Mm-hmm. Well, I think there's going to be flexibility, I think would be my first point. Schools, teams, and individual teachers will be able to have flexibility with how they would design those schedules. But we want to get as much structure in the day as we can for students when they're at home on asynchronous days. That's one of the reasons to use the concurrent model, is so that there's still an opportunity for those students and teachers and students to connect with their peers. But we did share a sample schedule, as Dr. Brabrand mentioned, just one. We're developing many. But that schedule, if you do have a chance to access it, and it is posted on board docs as part of our presentation, you'll see, just as the caller mentioned, that there are screen time breaks built in, and there are other structured opportunities for students to do things off of screens in ways that will keep them engaged in the learning environment, but also recognize that they do need to have breaks during and throughout the day.
Thank you, Dr. Presidio. I want to thank all of you for joining us for the Return to School Town Hall this evening. I so appreciate your questions and your feedback, and I want to reaffirm to you that we will, working together, get through this together. I had the privilege today, as being president of the Virginia Association of School Superintendents, to introduce the Honorable Ralph Northam, Governor of Virginia, to all of Virginia's superintendents. He shared a message, a very simple message, one of support for public education, but more importantly, he shared, this is not what I know you signed up for. It's not what I signed up for to be superintendent, or what you signed up for to be a parent, or what your students signed up for. COVID has changed our landscape in ways that will forever be changed. I can't go back to the past. But what I can do, and what Michelle and Sloan and Leah and Sean and all of us here in Fairfax County Public Schools can do now, is to rally around all of you, all of our staff and students, and continue to provide the best education we can, knowing that COVID is with us for the long haul. That is what we've attempted to do as we started the year virtually, and that's what we're going to continue to do as we work to very carefully, in a measured fashion, return students to in-person instruction. There is no perfect solution. There is no perfect plan. There's the very best that we can do, and we're committed to doing our best and continuing to communicate with you and listen to you as we continue this journey together. Thanks again for coming out and listening today to the Town Hall, and I hope and will be coming to you again soon with another Town Hall in just a few weeks. Thanks again, enjoy your evening, and we'll see you soon.